Okay, hi Zoe. Thanks for coming for the interview today. How are you doing?
I'm great, thank you. Thank you for
Good,
having
good.
me.
I'm glad that you were able to come in. I'm really excited to get to learn more about you. So, what areas of nursing are you interested in?
Right now, I'm interested in mental health and pediatrics.
Okay, all right, that's interesting. What has sparked your fascination with this field?
Mental health because I have personal experience dealing with mental health, and I think I can put a lot of input into mental health. Um, and also, I want to practice different things, and I want to ex- actually do more work and learn more stuff about mental health. And pediatrics, I just love kids, and I think if you groom them when they're young, I think we can make them to be better adult. So I really want to focus on pediatrics.
Okay, all right, that's great. So, I'm looking at your resume here and I see some interesting things. So, you want to tell me a little bit about your clinical experiences?
My clinical experience, it was really hard to find a clinical site, but I had pediatric at all pediatrics. It was a great experience. I had a really good preceptor who had pediatric experience for 30 years. She taught me pretty much everything. That was really good experience, and I actually was really happy getting to know her because I never met any nurse who's that warm and caring. And I
Mm-hmm.
think she actually showed me what nurse can do to other people. And my mental health was at Novan Health, and I actually was dealing with inpatients, and I got to see many different mental health from different patients. That was a really good experience, and dealing with them and then giving medication and going into counseling with them, it actually opened my eyes. And my med surge is at home health care. It's a little bit different than how most people do clinicals, but it's actually good experience for me because I actually go into somebody's house to take care of them, and it gives me more of caution of how am I going to deal with in their house, because hospital setting is more like open to everybody, and when you go to somebody's house it's like private setting.
Mm-hmm.
So I have to really be careful how I'm doing my nursing. Like I have to wash my hands, but I have to ask them before I use their bathrooms and stuff. So yeah, but overall I had a good experience with clinicals.
So it sounds like you really enjoyed all three of those. If you had to pick a favorite, which one would it be and why?
I think pediatrics was my favorite because I had my preceptor just showing me everything, and she actually had a lot of experience. So she trying to be my mentor, and even now I contact her and asking a lot of questions, and I want to be like her when I grow up.
It's good to have a role model
Yeah.
when you grow up. So, what is thinking back on your clinicals or your time as a student, what has been your biggest mistake that you have ever made, and how did you resolve that problem?
We had, when I was doing pediatric rotation, we had 5-day-old baby came in. He was all gray and pretty much blue, and we put him on his little to get his weight, and I didn't even know what to do with the baby because my job was to go weigh the baby and then bring him back, and parents were freaking out and I was freaking out because I had never seen baby turning that blue. So I had to get my preceptor, and she helped me, and she had to, teaching a lot of stuff. She said it's normal for that baby. Um, I mean, she did pretty much everything, but I think that was my biggest mistake, not knowing what to do. Instead explaining to parents, I'm gonna go get my preceptor. I just ran to my preceptor and said, "You need to come and help me."
Well, because that was a pretty serious situation,
Yeah,
so I would say that you probably did the right thing if you were unsure. So,
yeah.
okay. And sounds like you learned something from that situation
I
as
did.
well. Yeah. So tell me a little bit about yourself. What do you see as your strengths? What do you see as your weaknesses?
My strength is I'm a team worker. I always encourage people around me to do better. And I don't keep information to just myself. I always share information if it's important. Um, I think teamwork is my strength. My weakness is sometimes I can shut my mouth when, if I know I'm right, I just have to fight.
Bite your tongue, right?
And I have to win. So, yeah, I really have to watch myself not putting in that situation.
Okay. Let's see here. Can you tell me about a staff nurse who most impressed you and why?
That was my pediatric preceptor. She was very impressive. She still going to school. I think she's getting her master's degree. She was NICU for NIC, actually pediatric nurse for 30 years, and she has so much experience. But I think the most important thing about her is her tone hasn't changed ever since she became a nurse. She said, "My goal is to take care of people, have a smile on my face," and that's what she was doing when I met her. So, after 30 years, she's still a great nurse, and she still makes the little kids happy, parents happy, always have smile on her face. And if I, I don't want to lose that when I, become an RN and going through stress. I just want to be like her.
Mm-hmm. Sounds like a good role model. Sounds like somebody that really enjoys her job too, right? So if you enjoy your job, it's easy to be happy, I guess. Okay, how would your most recent nursing instructor describe your performance in the clinical setting?
My home health care preceptor told me I have very strong personality, but she said I'm very good at assessing patients, and then my interaction with patient is very good. So yeah, she complimented that a lot.
Oh, good. That's very good. Okay, so can you tell me a little bit about your most challenging clinical assignment and what you learned from that?
My clinical assignment, that was my 89-year-old male who was, he used to be a dentist. Now he's at home. He has Alzheimer's. He has a lot of problems. He has sepsis. He has congestive heart failure. So his people who's taking care of him, he has 3 nurse aides rotating to take care of him. And when I first met him, you can tell they weren't doing their job.
Mm-hmm.
But all 3 of them were getting paid, but his medication was all messed up. He's continuously getting infection on his feet. So they're not doing their job. They're just sitting around doing nothing. But I just felt like I couldn't do anything because I'm a student nurse, and that was the hardest part for me because I wanted to step up and just say something to them. But my preceptor actually stepped up and say something to them, and now he's gotten much better after month and a half.
Yeah.
So that was hard.
Okay, well, it sounds like you did the right thing in that particular situation, so that's good. All right, well, looking back on your past work experience, what skills do you feel that you can bring to nursing in this new position?
I used to run immunization clinic, so I'm good with immunizations. I used to do dermatology nurse, so I'm very good at surgery and dermatology, skin cancer stuff. And I did pediatrics. I'm pretty much overall well-rounded on each area, except cardiac.
Okay. All right, so can you tell me a little more about yourself? How would other people describe you? as a person?
I think most people describe me as an energetic and go-getter, because when I set something to do it, I always make sure I get that done. So I'm more like goal-oriented person.
Okay, all right, great. Can you tell me a little bit about your future career plans? Where do you expect to be in 2, 3, 5 years from now?
I'm planning on going back to school to finish BSN, and in the next 5 years, I actually want to get a master's.
Okay.
So I want to continue work on my education.
Okay, all right. Unfortunately, right now we don't have any openings in the areas that you're most interested in. Would you be willing to accept a position in another area?
Sure. I'm a fast learner, so I will take whatever you give me and I can work on that.
Okay. Can you tell me about a time when you had to establish priorities during one of your clinical experiences?
Yes, we just had a wound care a couple days ago. My patient had a surgery, and then we have to go inside his house to take care of his wound. He didn't take medication. Our appointment was at 1:00, and we actually got there a little bit early, 12:30, and he was laying on the couch. He's in pain, and before we assessed him, I asked him if he was taking pain medicine, before we start wound care, and he said he hasn't. So we have to wait a little bit and then give him pain medicine first before we change his one side, because it was a big one, and that was my priority. I have to actually, let patient know he needs to take medication to ease his pain.
Yeah. Okay, great. That's good. Sounds like, putting the patient first, making sure that their needs are met before you continue on with your job. So, all right, that sounds good. Can you tell me maybe about a time when you went out of your way to assist a family member or a patient, even though you really didn't have the time to do so?
I do that a lot at dermatology clinic because we're a specialty clinic, so we don't have many appointments. But when patient actually calls and say they have melanoma, and I have to actually find a way to give them appointment, because that's those patients are our priority, recurrent skin cancer. So I normally go out and find a way to give them appointment.
Okay. All right. Well, Sohi, thank you for coming in. I feel like I've gotten a good feel for your skill level and who you are as a person. But I want to open this up and ask you if you have any questions at all for me.
So how long is the orientation?
The orientation is 1 week long.
1 week, okay. Does that give us enough time to be efficient in patient care?
Yeah, in this hospital we have a really good routine. So we have our orientation Monday through Friday. It's a full day. It's 8 to 5 each day, and we cover everything that you're going to need to know for your job position. All right. Do you have any other questions?
No, ma'am.
All right. Thank you so much, and I look forward to seeing more of you later.
Okay.
Thank you.
Thank you.